Hi, we are doing the rehabilitative frame of reference approach, and this is Stephanie, Amanda, and Gala. So, what is rehabilitation? Something that, as occupational therapists or occupational therapy assistants, we're familiar with. We've heard the term, we tell it to our clients all the time, but what is it? So, it's a therapeutic process that helps individuals restore, maintain, or improve their abilities after they have an injury or disability. How is that different from the rehabilitative frame of reference? So the frame of reference is an approach that looks at the client's abilities and how can they live and work after having an injury with their remaining capabilities. And what this involves is modifications to their environments, adapting activities, or compensation strategies. Populations where this approach is commonly used is ALS, stroke, amputations, and spinal cord injury, but it's a very broad approach. So it can be used in collaboration with other approaches such as the biomechanical approach or the sensory motor approach. Some examples of interventions and types of interventions that might be used by occupational therapists are training in occupations, and there's three top occupations that are associated with this type of approach. There's self-care, there's work and leisure. And these three occupations are the most important because they're the most significant for the client. They also are, the other interventions involved are use of assistive technology, energy conservation, work-related activities, things such as wheelchair management or managing canes or other types of adaptive equipment, modifying the environment, home evaluations, and modifications. So let's talk about the beliefs and the assumptions with this frame of reference. So one of the most important things with this frame of reference is that the client is an active participant. They need to be actively involved. Occupations should occur in their natural environments. That's the best way to see how the client can compensate. How is the environment impacting the occupation? And taking a strengths-based approach. So the main thing with this is just focusing on the client's abilities rather than their disability. Some assumptions that are associated with this frame of reference are that motivation is going to greatly impact the rehabilitation process. So if the client isn't motivated, this is going to impact their level of independence or how they perform the activities. Another aspect is the environment is going to play a huge part in it. So if the environment is not helping the client be successful at their occupation, this is the time to just help adapt the environment to make them successful. If the performance skills cannot be remediated, then at that point, compensatory strategies are going to have to be used in order to gain independence. The process of rehabilitation involves learning, teaching, and factors that have to be considered are, again, motivation, their cognitive level, their learning style. So all these are going to play a factor into how the client is going to perform the activity. And then to summarize, the therapeutic process involves identifying first and foremost, what is the most important thing to the client? What are their goals? What's the roles that they find are important? Next thing we're going to look at is what are their capabilities? What are they're capable of? What do they have still? What are their strengths? Then we want to understand the environments in which their occupations take place. And then finally, what are the compensatory or adaptive strategies that will help enable role performance? So this is where the therapist and the client get creative and work together to decide what are the things that are going to work specifically for this client. Okay, so now Amanda is going to come on with the next part.
So related evaluations and assessments. The goal of the rehabilitative approach is to perform a comprehensive analysis of daily activities to identify performance areas that contribute to a reduced level of function. This can be completed through the COPM, observation during activities, self-report from the client, interviewing the client to determine what is important to them, strength, sensory, cognition, and perception, environmental, and vocational history. Other assessments can include ADLs, which can include the FIMS and Barthel's, range of motion, manual muscle testing, endurance, cognitive assessments, such as the mini mental state exam, ergonomics, assistive device, and orthotics. The occupational therapists use a client-centered approach by using assessments to identify the appropriate interventions. Some of the most common are ADLs, as these are both meaningful and purposeful to the client. In addition, it provides the motivation to participate in the skills they need to live an independent life. The environment and context where it is used most commonly is inpatient rehabilitation, outpatient settings, home health, acute care hospitals, and skilled nursing facilities. Dala is going to continue by giving us a case example.
As brought out earlier, the rehabilitative frame of reference it can be adapted to a broad diagnosis. In this case example, we are looking at a patient with a cerebral vascular accident or stroke. And the first thing that would be assessed would be the patient's during the evaluation to determine the patient's strength and the deficits in the affected areas that is making it difficult for the person to complete their ADLs and IADLs. And the emphasis will be on these deficits to build up their existing strength. There might be environmental modifications that may need to be done, adaptive equipment, such as a reacher, a long-handled sponge, or compensatory strategies, hemi-dressing, to promote independence in ADLs and IADLs. And intervention plans may include exercises such as range of motion exercises, strengthening exercises, mobility activities, functional activities to reduce deficits in the patient's occupational performance. The FIM or Barthel assessment tool will be used also to measure the progression of the patient in the area of the bathing, upper extremity, grooming, lower extremity dressing, transfers, wheelchair mobility, and tub and shower transfers.
So, the brief summary, the rehabilitation approach is used with a variety of clients in many different settings. The main belief of this approach is that occupational therapy focuses on what the client has and assists in either making modifications or compensatory techniques to assist the client in being independent. The client must demonstrate motivation to achieve their goals.